An EOB is issued by your insurance every time a claim sent by a medical provider is processed. It is one of the most important documents you can receive from your insurance, and you must be familiar with it as your financial circumstances will be affected by this document. Welcome. I am your medical bill whisperer, a previous billing manager turned patient advocate. I'm committed to bringing answers, insights, and solutions to patients like you. So today, let us explore what is an EOB, why you should care, and some tips. EOB means explanation of benefits. It's a description showing what medical service was rendered, the level of responsibility your insurance has determined it holds, and what your financial liability is. It is a legal contract between you and your plan, as well as one between the medical provider and your plan. What is on that EOB rules and will determine whether you owe something or how much the provider can bill you for. I review every one of the EOBs my insurance sends me. First, demographic data. Is it the right patient? The right ID number? A small error on the part of the office will get your claim rejected. Next, who is the provider? Is it someone I hired and consulted with, or someone who treated me by extension? For example, an anesthesiologist or a pathologist. Was that the right date of service? And especially what type of service? An office visit, a surgical procedure, or something else? When it comes to coverage and benefits, things can get serious. Is the service covered, pending, or denied? If there is an allowance, then the claim is approved. But if the allowance is zero, then a note should indicate the specific reason why the claim could not be processed. Any such rejection or even pending claim must raise alert. Who needs to take action? Who may have made a mistake? Should you call your insurance or your provider to sort it out? Last, what was the level of payment? There are only two, in or out of network. In-network means you get a discount from the medical provider and have a lower liability. Out of network, the insurance will allow less and pay less, if anything at all. You may be responsible for the full amount billed and won't get a discount. Finally, the last portion of an EOB will reflect your share of cost. It can be divided into the deductible, which is the amount you pay first before your plan pays anything. Your co-insurance, the percentage you pay while your plan pays the rest of that allowance. Copay, the set amount you pay for a doctor's visit or an ER visit. And then the red flag, not covered. It usually means the claim was processed out of network and that amount is your responsibility as your plan has declined to cover it. So to recap, look at the allowance. That will tell you if an insurance has accepted responsibility for the service or not. Then look at the provider status, in or out of network. Last, look at how much was applied to patient's responsibility. So why should you care? Because, first, it's a legal document. You owe the amount indicated on the explanation of benefit. Well, unless, we'll see in a little bit. It is a legal in-network contract, meaning your provider must abide by it if they are contracted with your plan. So their bill to you must match the amount listed under patient responsibility on your EOB. And although you have no say or even advanced knowledge of the rates of payment the provider and your plan have agreed to in their contract, you are held responsible for payment to that provider per that EOB. But another major reason why you should care are errors. According to some studies, 20 to even more percentage of all claims are processed incorrectly. Some reasons: not recognizing specific circumstances such as emergency, which might have to be processed and paid at the higher rate per state or federal law. Your insurance ignoring state or federal mandates, which may force higher payment for services rendered at an in-network facility by an out-of-network provider, for example. But also, not honoring an existing authorization, applying the wrong rate, miscalculating or overcharging your deductible or yearly share of cost. Now, the good thing with EOBs, especially if they have errors, is your right to an appeal. An appeal, which is also called a grievance, is what you or your medical provider are entitled to, a request by your insurance to review how a claim was processed if you feel or know an error was made. The insurance would then have to audit the claim, rectify the error, and issue a corrected EOB. How to file and when to file an appeal is detailed on every EOB you receive. Filing and winning an appeal usually results in a lower liability. I encourage you to look at my videos on how to file those appeals. Now, no worries, I have some tips for you. Always reconcile every statement you receive from a doctor or hospital with a corresponding EOB. Although matching amounts owed by you may not be correct, they are surely a red flag if different. The information on the EOB is correct, and especially the in or out of network status. A provider may have billed using an out of network tax ID number in error. A brand new contracted doctor may not have their info updated in the insurance system yet, or a special authorization that covers out-of-network services at the in-network rate may have been ignored. Double-check how the claim was processed. Preventive care services at no cost to you might have been processed with an office copay or denied incorrectly for non-eligibility before the system could be updated. I would examine every denied or pending charge. Although they may be legitimate and don't get paid, others might require a call to your insurance or follow up with the provider. Coding errors, for example, can be easily remedied. I file appeals anytime I suspect or am sure of an error. Charges that show a 1 cent billed amount can be ignored. These are reporting measures that do not affect payments or what you owe. And when in doubt, contact the provider's billing manager or your insurance claims department rep. Many errors can be corrected over the phone without the need and efforts to file an appeal. And if questions remain, do contact a patient advocate specializing in billing and insurance matters to determine what it means and what your options are. I so thank you for watching. This channel grows with your comments, your likes, and your subscribes. So thank you.